Hello, Dr. Tan. Welcome.
Hi, morning.
So I'm very happy to have you today to talk with us about psychological testing. I know you are an expert in this area. So first, can you help us understand what is psychological testing exactly?
So, psychological testing, or you'll hear psychological assessments or neuropsychological assessments. Those are all different terms that refer to a set of activities and tests that psychologists use to help people understand their different areas of functioning more. So, there's cognitive functioning, so that refers to intellect, your memory, how fast you process things. There's different aspects of that as well. There's visual processing, auditory processing, verbal processing. So those are all the terms you'll hear when we're thinking about cognitive testing. Then the other piece is social functioning, how someone relates to people, just casual social interactions or within their family or in a work setting or a school setting. Just you relate to others in each of these different places and these different contexts, because maybe there's presenting yourself as a student or a professional versus when you're talking to mom or dad, that can be a little different. So that's another big area of functioning. And then one more area of functioning that we look at is adaptive or daily functioning. So these are things that someone might do every day to take care of themselves, from hygiene, like brushing teeth, showering, laying out clothes, to transportation, how they get around, or how they feed themselves, can they grocery shop, things like that. So these are the different areas of functioning that psychological assessments or testing can look at and help an individual understand where it is exactly that they might find things more difficult, or where it is exactly that they find things like really easy and maybe that's their strength. So that's a broad view of what psychological assessment is.
Wow, amazing. So sounds like this testing covers so many different areas of functioning of our ability. I can imagine it can help us understand a lot of things in the process. I used to work in a clinic. The help testing elders, right, to rule out dementia, to understand the recovery process after a brain trauma, for example. And in our
Yeah.
clinic, I know we do a lot of testing for children, adolescents, families to diagnose autism, ADHD, or we do IQ test. So seems like it's a very broad area. So I want to
Yeah.
understand in your clinical experience, what when a family or an individual really need to come in to seek this kind of psychological
Mhm.
assessment service.
So there's many different channels through which someone ends up working with us. So
Hmm.
one could be when other people tell your family like, they've noticed things. And when I say other people, maybe your pediatrician or your family doctor at regular pediatric appointments. You'll do questionnaires to say, is your child talking, eating, doing different things on their own? And then sometimes if you are not sure if your child doesn't do some of these things, then sometimes pediatricians will recommend, oh, maybe this is something we should find out more about. Sometimes it's just a developmental phase, and children develop at different rates. So then that is something that could be possible. But sometimes it's also helpful to really look at it and see if there is something diagnosable that is really getting in the way of your child learning or progressing. So doctors, at your regular appointments, when they check in on milestones, they can help you talk through that, and then you might get a referral to a psychologist then from there. Another person that might notice things about your child is a child's teacher. Children spend a lot of time at school every week, so teachers really have the ability to notice things about your child. Maybe they're having trouble following along with the class. Maybe they're having trouble getting along with classmates, and they might point these things out to you. And so when you hear feedback like that, sometimes it's helpful to really think a bit more about if maybe your child might need a little more support in a more formal and targeted way. And psychological testing can help identify that. So those are like if you hear feedback from other people. But then sometimes no one else says anything. But what parents might notice is that, oh, there's so many daily things that are such a struggle, and maybe you don't hear other people talking about the same struggles, but you feel like, say, just getting dressed in the morning and getting out the door is a battle every day. And maybe it doesn't need to be, or maybe there's different strategies that could be helpful, but then it's hard to figure out what exactly those are. And then so psychological assessment is another way to get a big picture of what's going on, figure out how your child thinks, whether maybe it's like an attention or hyperactivity issue that's like coming from ADHD, or it's coming from a place of more your child expects a certain routine every day and it really throws them off if things don't go according to what they expect. And then that can be, maybe we're thinking along the lines more like autism spectrum. So there's a lot of, parenting is hard, and there's a lot of like struggles that parents often encounter, and sometimes they are just part of life, and then other times it's really helpful to think about like, oh, is there something else going on? And that's when psychologists like us can help.
Great. Yes, I know in America, at least, licensed psychologists do a lot of this kind of psychological testing service. And so just to help our listeners to understand, if someone come to seek this service, what this procedure may look like, what does it involve?
Yeah, so it, especially with children or even if adults, you're seeking testing for yourself. Speaking from our experience at Mind and Body Garden, our clinicians are really collaborative. So it'll start with a phone call just to get an understanding of what is it you're struggling with. Is it something that psychological assessment can help with? We'll talk you through the overview of the process. And so the process itself, when testing actually starts, it will look like a combination of interviews, conversations, and also including some really formal testing procedures. The testing procedures can look like different activities that the clinician does with the individual. Sometimes it could look a little bit academic, where you're doing something on with pen and paper. Other times it's you're using different objects, manipulating objects, or you're just talking with the clinician. So at our clinic, we usually have an interview, and then we have maybe one or two more sessions where we're focused on doing those activities. And then at the end of collecting all our information, including questionnaires that we might send to you, we will put it all together in a written report. The report will describe what we did, what the results mean, and then also whether or not there's a formal diagnosis, and then ideas for what to do next. And we will have a session with you to talk through what's in the report so that you really understand what we did together and like what does it all mean, and also give you ideas for what to do next. So that part like is really important, and our clinicians are really passionate about this work, and they will walk you through every step of this.
Great. Sounds like also finding a very professional team, professional psychologists with this kind of experience can help you feel better in the process. They know what they are doing. They will help you prepare it well. So a question I get from a lot of clients and friends when they know about this service always is, can I prepare for this? Is there something I can practice ahead of time, or how I can make sure I perform well in this kind of testing, or make the testing really valid?
Absolutely. So the idea behind testing is we want to see what you're like at your usual, at your most normal, when you feel like most like yourself. So in that sense, there's no studying to do. We want to just you come as you are. Or come as your child is. The only thing is we do want you to be on that day, have the energy level to be able to engage with us. So for children, this could be like the preparation would be, okay, they're not sick. They had a good night's sleep. They're not hangry. They're not hungry and grumpy. So really, we just want to see you as you are. So no studying needed.
Great to know. So whoever want to come for a psychological testing, right? Don't worry. Just make sure you come at a good energy level and just come as who you are. That's really good advice. Thank you. So another question is, after going through all this and sit through this testing and doing a lot of things, what are some value of such testing? How, I know after testing, we're gonna give a report, but what can people use the results for? Why it's so important sometimes to get a testing done?
So, in a really practical sense, for children, if they're of a school going age, the assessment, if there's a diagnosis, sometimes this really gives you justification or the formal language with which you can use to then request for formal support. And it could be finding support from school, or seeking other kinds of therapies. Very often for kids, additional things that happen after the assessment, it could be psychotherapy, occupational therapy, speech therapy, or maybe academic tutoring, maybe more one-on-one time with a tutor or a school aide. So this testing really gives families the formal language that they can then use to network and talk with other providers to get the specific help that a child needs. And then for adults, sometimes, depending on your work setting, sometimes it could help you get accommodations that you might need as well. So for example, I've had adult clients request that maybe they don't hot desk, they don't move around from desk to desk, they get their own assigned desk, or maybe they can use a room instead of being in an open office all the time. So sometimes having the language that comes out from a psychological assessment can help you access different kinds of accommodations that help you build your life in a more productive or more comfortable way.
Very useful. Sounds like testing results can not only help us understand ourselves better, but also connect us with a lot of resources to help us to be more successful.
For sure. Another really common use case for testing is some people, if you're applying for graduate school or for certain licenses, sometimes test accommodations are really helpful if you do have a formal diagnosis of say ADHD or autism. Maybe having the test set up in a certain way would be helpful to you to demonstrate your best ability. And assessment services can also help you document that need and access those accommodations.
Wonderful. Yes, that's great to know. And earlier you mentioned, I know in our clinic, we have a whole team of licensed psychologists doing this kind of testing. And in my practice, I have clients ask us, they are looking for testing. Sometimes there's testing done within the school district. Sometimes it's done by an educational psychologist. So a lot of clients are very confused. What are the difference? Who does psychological testing exactly? Can a therapist do it, or it has to be a psychologist? And why there's so many different settings? What are the difference? Can you help us understand that better?
Yes. So clinical psychologists have formal training in psychological assessments, like using different kinds of assessments. Therapists might be able to maybe let you do some questionnaires, maybe start talking to you about, like, if they've noticed anything might be a bigger issue. And then they can be your stepping point or like part of the screening process to let you know when more thorough psychological or psychoeducational assessment might be helpful. And then for school psychologists, very often they work within the school district. And then depending on their training, a lot of school psychologists can do assessments for learning disorders, for ADHD, specific learning impairments, that is, or other health impairments that they might identify for someone to qualify for an IEP. And then clinical psychologists, if sometimes it's hard to understand a report, so our clinical psychologists can take that information together with any other additional information you may have and sometimes talk you through that. Sometimes school psychologists have a very specific issue they're going to look for, and maybe it won't cover as much as as a clinical psychologist could. So it really depends on the person's training and what your referral was for with the school psychologist. But speaking as a
Yeah.
clinical psychologist, we can look at specific learning disorders, intellectual functioning, as well as social functioning. And so oftentimes, if someone was concerned with autism, really families would go to a clinical psychologist to really get that whole thorough picture.
So if I understand correctly, to put it in simple words, clinical psychologists are most well-trained, that is all-rounded, can cover most and almost all psychological testing requests. And you can discuss with a clinical psychologist to tailor the testing based on your needs. For other type of testing people, for example, school psychologists or educational psychologists, they may be able to help you with one part of the request or questions. And also clinical psychologists are able to help you read your other reports from other providers and help you interpret it, help answer your questions and give some suggestions even. And I know psychological testing results can be used to guide clinical treatment in a way. So it's very valuable in both treatment intervention setting and also in guidance and resource connection purpose. And so then there's a very common question. For example, a child or adult want to diagnose ADHD to consider, should I take medication or not? Do I need extra testing accommodation from school because I have ADHD? I need to diagnose, right? Sometimes they just go to a psychiatrist and get a diagnosis. And to my knowledge, I hope I don't offend any psychiatrists, but a lot of psychiatrists just meet with this person for 15 minutes or 1 hour and then give a diagnosis. But clinical psychologists, we take it much more serious and we do more through testing. What's the difference between getting a diagnosis from psychiatrist versus a clinical psychologist?
Yeah. So if you were to come to, say, our clinic or to work with our psychologists, have a really thorough process for addressing ADHD. And the idea is we don't want to understand something as ADHD when maybe it is anxiety or a bad night's sleep. So what our testing involves is a very thorough interview with you, or if it's a child with the child's caregivers. And then we also have a set of cognitive tests because we really want to identify which part of attention is hard for you, or which part of memory is hard for you. And then when you work with a therapist or figure out strategies for yourself after that, it's more targeted and specific. So, for example, we might be able to tell from our testing that maybe auditory processing is harder for you. And then in that case, strategies for working with that is maybe you give yourself more visual cues. Or if you're really trying to remember something you heard, then a clinician could coach you to like, okay, maybe you need to imagine what you heard and give yourself a mental picture of it so that it'll help you be able to hold that in your mind better. And so psychological testing that includes cognitive testing can really help you identify which part of attention or which part of memory is harder for you so that when you're figuring out strategies later, it's more targeted and unique to you.
So it's not just a diagnose to label you, right? It sounds like psychiatrists, because the time is limited and they don't use any other cognitive testing materials. So it's really, maybe they can label you and you're good to take medication or not. But clinical psychologists can help you dig deeper to understand, first, do I really have ADHD, or actually this is something else, but they look like ADHD. Even if I have ADHD, which aspects of that really bother me, that I really struggling? Because even it's inattentiveness, right, which is one common symptom of ADHD, it's not just everything inattentive. And there's still maybe very niched, narrow area within attention that some attention aspects were better than others. And it sounds like using psychological testing can really help us figure that out. And I can imagine then the intervention after that gonna be well guided because you are not just rely on a medication. You also know which certain area of problem I can work on. I can build that up further, right? Or I can find some way to accommodate that because I know myself better in a deeper way, in a more detailed way. So I know what to do behaviorally, cognitively. I have guidance. Even without medication, I can still do something. And sometimes, of course, people need to take medication as part of the treatment. But sometimes I believe there are other strategies in the picture that can help people as well, right? In addition to medication. Especially, I know some families or children or certain adults, for cultural belief, for health reasons, they are hesitant to take medication. Then I think get a deeper understanding of your own symptom can be really helpful in these kind of scenarios to help you understand what else I can do to help myself.
Yes, exactly.
And I actually also know, not in California right now, but in some other states in America, for example, Michigan, they now, a psychiatrist cannot just diagnose you with ADHD. I heard you have to, in order to get diagnosed of ADHD, you have to see a licensed psychologist to do some kind of testing in order to get diagnosed, which I think is very responsible to every client, that you get a deeper understanding of yourself, not just through talking for 1 hour and then you get diagnosed.
There's a certain element of thoroughness or more personal responsibility involved when you go through the process. You really understand what's going on for yourself, and then you feel maybe hopefully more empowered to be able to have like really specific strategies that you can use.
Another question we often get is, can insurance cover psychological testing? And I know payment is a big concern for a lot of people. And anything you want to share around that?
I think that is something that each individual really needs to check with their insurance companies. Sometimes, if it's for a child, very often the first step might be to check with the school district on what they could do to help you, and then insurance coverage or diagnoses that are maybe beyond the school district that are not solely psychoeducational. There's maybe potentially a medical or maybe more lifelong element to it. Like autism testing might more commonly be covered, but that is something you really do need to check with your own insurance and policies. And then a clinic such as ours might still be able to work with you using your out-of-network benefits or in terms of figuring out like payment plans if you were to pay out of pocket.
Yeah. So every clinic is different. Every insurance plan is different. So you need to use the school resources, check with your own insurance company, and talk to the clinicians, right, the psychologists, to figure out a plan what is more doable for you and your family. I know in our clinic, Mind Body Garden Psychology, we have quite some advantage compared to many other hospitals or clinics, right? And in your clinical experience, I know you have worked in different settings. What do you think our clinic is different than other clinic?
So one, we have a really great team of clinicians, and we really do have the capacity to take on new cases. So there's no super long waiting list if you were to work with our clinic. The other piece is our clinic is bilingual. We do have Mandarin speaking clinicians, and we can work with the families to sort of figure out the best testing plan for you. We are also clinicians who really love our work. We really care for the people we work with. And so our process is really collaborative. We will include you in figuring out what is it exactly you're looking for. And then we will tailor our assessment battery or the different tests that we pick to really address your questions.
So I think it's really great that we have a lot of licensed psychologists in our clinic focusing on psychological testing. that, like Dr. Tan said, that really help us tailor the whole testing experience to your needs. So that's a very special, individualized touch in this experience. And we have wonderful bilingual team, which is very unique. When I did an interview with Dr. Jing, another psychologist in our assessment team, she mentioned that we can deliver autism diagnostic test, for example, in Chinese if it's needed. And then it's as a type of accommodation, and we're gonna explain that in the report. And it's still a valid report, but it also help the child if the child's language is not very well developed in the English area, right? They speak Chinese all the time. Then if you test them in Chinese in the interaction, it actually help a lot. It reduces the chance of misdiagnose, and you don't count those language barrier as part of the dysfunction or something. So I think having a clinician can speak the language. Even some tests you cannot do it in Chinese, but you can still communicate with family, right? Outside of the testing setting in Chinese, that still help a lot. So I think there's a lot of uniqueness when you choose a psychologist team to see what is the best for your family. Also, I think no wait is a big charm. Our clinic is so close to Stanford, and I work in Stanford part-time also. I know Stanford Hospital, if you want to do a psychological testing, the wait list is at least half a year long. So that means for half year to 1 year period from you are being put on that wait list, you are not able to get a testing done. You have to wait for that long time. Sometimes it's a big delay, I think, for children and family to get services because you have to get diagnosed before you can seek any services from the public resource, right? It's just a lot of trade-off I think we have to think about when we seek services.
Yes. So no wait lists, bilingual clinicians, and we will also take the time to explain to you what we did and what it means. I think that part is really helpful to a lot of families to really understand what you're spending time with us doing, and like how it can really give you a good foundation for figuring out what the next steps should be.
Yeah. And so if you ever need psychological testing, and if you want to consider us, if you're in this area, feel free to contact us. Our website is mindbodygarden.com. And we have a special assessment page with a lot of different services we can offer. And I will put the link down below in the show notes. Well, thank you very much, Dr. Tan. Any last wisdom you want to share with everyone?
Well, we're here to help, and our initial phone call consultation is no charge. We really do want to help you, so definitely feel free to contact us.
Thank you. Feel free to call us or text us at 650-434-2563. And we have a whole admin team and a lot of great psychologists behind that phone line. We are ready to offer help. Well, thank you everyone for listening and watching. And thank you, Dr. Tan, for taking your time. Help us understand the psychological testing service better.
Thank you. Good to be here.